Hello, my name is Marvella Garcia, and I'm going to be talking about Chapter 13, Specialized Formats and Procedures. The standard group therapy format consists of a single therapist who meets with 6 to 8 different members for a session. Group therapy typically addresses interpersonal issues that are occurring in the present, while the focus of individual therapy is on early life dynamics and intrapsychic issues. Different variables can alter this standard group therapy format, such as a member who attends concurrent and group therapy, specialized techniques, and specialized approaches. There are basically two types of therapy: conjoint therapy and combined therapy. In the conjoint therapy format, a member typically attends individual therapy with one therapist, along with seeing one or two co-therapists in a group therapy session. In the combined therapy format, a member is seen by the same therapist in the individual therapy sessions and in the group therapy sessions. Each type of therapy format offers its own advantages when used alone and combined. Each modality of therapy can be used to enhance or augment positive treatment outcomes for the patient. For example, conjoint therapy is best used for the advantage of helping challenging clients that have issues that cannot be addressed with only individual therapy sessions. Such examples include intense transference that can be diluted in the group therapy setting, de-intensification of countertransference, patients being able to learn how to transfer learning from the individual therapy sessions into real-life settings, and major blind spots and roadblocks can be addressed in a different setting. The conditions that need to be met for both therapeutic approaches to work include a good, solid working relationship between both the group therapists and the individual therapists. Permission must be obtained for all therapists involved to share information with each other. All should have a commitment to the indication and reasoning for the conjoint therapy to be taking place, and mutual respect. For the combined therapy modality, individual therapy is typically enriched and patient goals accelerated by means of utilizing the group approach as well. Dropouts are decreased. Individual therapists have the advantage of making accurate selections for candidates for group. Therapists can also utilize individual sessions to address and resolve issues that have blocked clients' progress in the group setting. The group setting, through the various interactions between group members, can also open up areas to be addressed and resolved with patients that would not have surfaced in individual therapy sessions alone. Combined therapy also aids the therapist to realize limits in the knowledge that they have of their patients. A type of concurrent therapy is working with patients who are attending group sessions in addition to attending mutual support groups. For individuals who are suffering from substance abuse issues, group therapy aids in recovering by helping build sustainable coping skills while also aiding in attaining sustained remission. 12-step programs that are offered for many different types of addictions are highly respected by the members who utilize them and have proven to be very effective. Each type of therapy modality has its own specific approaches that work for them, and when they are both attended by an individual, they can work in a complementary fashion to achieve positive patient outcomes. It is vitally important for the mental health provider to have a good understanding of how 12-step programs work, so that they are able to facilitate a group setting with concepts that combine the format of group therapies and 12-step programs in order to convey the basic message that there is a commonality that exists between the two, which is that the recovery process itself and the therapy sessions are both mutually facilitative. Co-therapy has both advantages and potential drawbacks. The co-therapist can act as a support system for each other both during and after sessions. Having more than one therapist present during group allows for a broader scope to observe the interchanges that occur during group sessions between members. Co-therapists that consist of a female and male counterpart carries advantages for certain victims of trauma. For the therapists themselves, anxiety can be greatly reduced and objectivity is more manageable. Therapist disagreements can humanize themselves to the clients and facilitate strengthening the honesty between members as a whole, as well as effectiveness of the group as a whole. Some potential drawbacks to co-therapy are that therapists may become competitive and the singular purpose of the group can be lost. Senior therapists may undermine new therapists and create for the group a dominant submissive model. Disagreements can arise over different thinking, over most effective strategies to be utilized without any compromise. Rivalries can also occur and create unhealthy dynamics for the group. A good tip is to only agree to perform co-therapy with someone you like, understand, and know. Dreams can prove to be an essential tool that allows a therapist to be able to gain valuable insight into the unconscious dynamics that are at play with clients. Analyzing dreams can help to both facilitate and accelerate the therapeutic work of the group therapy. It can be productive for members to share their dreams when they pertain to the group or individual group members, as this may then open the door to discussing issues that had not consciously previously been brought up in the group discussion before. The use of audiovisual technology can prove to be extremely useful in group therapy sessions. When utilizing audiovisual technologies, recorded group sessions played back to the patient can offer tremendous growth for the client. The client is presented with a unique opportunity to view themselves as they are, which provides an unmatched and potent self-observation experience, which allows the patient a level of self-reflection. Providing self-observation to the patient is a powerful tool. It can be argued that information that is discovered by someone on their own is the most convincing type of information. An important factor in utilizing audiovisual technology is that confidentiality agreements must be obtained and set in place before any type of video recording can be done. Feedback from members and monitoring the group as individuals throughout sessions is a very crucial process of group therapy. Feedback and monitoring allows for being able to recognize and catch any problems early on in the process, decreasing undesirable clinical outcomes, and increasing the positive work that is achieved by the individual members through the group therapy sessions. Feedback can easily be measured and monitored through the use of questionnaires distributed to the members of the group. The main goal of monitoring throughout the group therapy process is to achieve the best possible outcomes for the individual members and to decrease the number of dropouts. Regarding group therapy record keeping, HIPAA should always be kept in mind and taken into account for all record keeping regarding sessions. All records should be written with keeping in mind that patients always have the right to read the records. It is very good practice to keep two different types of records, an individual record per member and a record for the group as a whole. Group therapy offered in specialized formats has the potential for creating many advantages and benefits for participating members. It is in the interest of all mental health practitioners to explore different modalities of group therapy in order to achieve the best possible patient outcomes for all members and create impactful and meaningful changes for all patients. Here are a list of the references that were used throughout the presentation, and I thank you so much for your time and for viewing the presentation. Thank you.